Good morning. This is a Capstone video presentation for my BSN. My name is Rob Williams, RN, and I will be talking to you today about using acupressure to reduce post-operative nausea and vomiting. Post-operative and post-discharge nausea and vomiting, PONV or PDNV, is one of the most commonly occurring post-operative complications. But healthcare providers have yet to reach a consensus regarding a treatment approach for this problem. Single pharmaceuticals, multiple pharmaceuticals, scent therapy, and acupressure are several of the many options available to combat this complication. The purpose of this presentation is to provide nurses with the information necessary to perform effective acupressure, thus reducing post-operative nausea and vomiting. The goal: the nurse will be able to independently implement acupressure as a means of reducing nausea. I do have a pre-test, so we will do that now before going into the presentation. Acupressure is a form of touch therapy in traditional Chinese medicine. It is believed that pressure to the area designated as P6 alters the energy flow of the body, thus reducing postoperative nausea and vomiting. From these illustrations, you can see where that location is. Acupressure is not widely accepted in Western medicine as of yet, although holistic and homeopathic ways of performing medicine is now being more accepted by the West. P6 is located on the anterior surface of the arm, approximately 3 finger widths from the first plantar crease and between the tendons of the flexor carpi radialis and palmaris longus. Very simple to do. Place your 3 fingers at the crease. Right above the third finger, you can feel between the tendons, and that is the location of P6. How do you apply acupressure? Well, it is simple as digitally applying pressure to the correct location bilaterally. It's not much pressure. You don't have to press to the point of pain or discomfort or cutting off of circulation and the numbing of the hand. As you will be able to see from the beaded wristbands that I have here, the pressure applied is minimal. A beaded wristband is a commercial option that is available at your local Walgreens, CVS, or other pharmacy. They can be bought over the counter. People use them to help control motion sickness on cruises and airplane rides. And as you try them on, you will see that the pressure they apply is minimal at the least. Due to its low cost, side effect profile, and relative efficacy, Nigon P6 stimulation could be recommended for universal prophylaxis or as a first-line treatment, possibly replacing the use of single prophylactic antiemetics or to be used in conjunction with them for people that are a moderate to high risk for PONV. The effectiveness of acupressure to relieve postoperative nausea. During the literature review that I performed for this presentation, I found that nausea scores of treatment groups were significantly lower than those compared with other groups during the study. The other groups received no treatment or only pharmacological treatments. Another study said there was a significant, clinically significant outcome in the decrease of vomiting. Contraindications for use of acupressure? Sure, there are some. If you've had a hand or arm surgery, if you've had an amputation where you can no longer apply this bilaterally, if there is pain caused by the application of the acupressure, or if the patient has an allergic reaction to the device, such as some reaction to the bead or the wristband, although they are non-latex. Are there any questions or concerns about using acupressure to reduce post-operative nausea? If so, I'd like to discuss those now. If not, I have a post-test. I would like to see if you have gained anything from this presentation. I appreciate your time. Thank you. Have a wonderful day.